Tom, can you hear me? Tom, you're on mute.
Oh, I can hear you.
Okay, can you run down the two plan options you have?
Oh, I'm sorry. I couldn't hear anything before. So where are we at?
You're on the agenda item for the discussion on the plan benefits for all employees.
Yeah, I'm sorry. I didn't hear anything before that. What would you like me to go through?
Just go over the plans that you discussed with us.
Okay. So we went out to market. You got a significant increase from Cigna, which was driven a lot by claims, but also just in general, Cigna's premiums are going to be higher on your dependents there. So Chief gave us several different objectives that we had to achieve. One was to try and come up with a means that made the plans more competitive, so that it would keep members from going over to Reeves and would keep them staying with you guys and understand the benefits. And we started looking at the premium breakdowns, and what we noticed was part of the biggest issue that employees seem to have wasn't the employee rate, because the department paid that, it was the cost of doing dependent coverages. Can I share my screen?
Yes, you can.
Okay, perfect. And let me know when you guys can see that.
We can see it.
Okay, thanks. Sorry if I'm coughing. I'm fighting strep and bronchitis. So looking at this, when you look at the cost for a dependent to put their family on there at $22,015 a month, looking at the salaries that employees make and such, there's really no way that they can afford to do that. And so that was driving members to start going and looking at Reeves County, which I'm very much aware of their plans. I know what they have. I know what they contribute. And what you were faced with was the cost differential was just not supported. So in other words, the cost to add dependents was not going to be where they could do that. We got a 20% increase from Cigna. We went out to bid with all the carriers. Okay, so those that are available to us, just so that you're aware, and you may or may not be aware, but Humana is no longer in the market. As of November 1st, they are closing their doors. It's the 5th largest carrier in the United States, and they are closing. The only thing that they will offer is Medicare in the future. So we did go out to TML. We went out to Cigna. Of course, we went out to Blue Cross Blue Shield, United Healthcare. Several other carriers out there, and all of them came back with declined to quote because of the claims, except United and Blue. And Blue Cross Blue Shield came in with a package that was exactly what we were looking for. What we were looking for was something that would allow us to get the dependent cost contributions within reach of a member. So in other words, when we look at how long it takes a member to drive to Reeves to come back, the amount of time, the gas, and everything else, we wanted to come up with a premium that made it not profitable for them to go out to Reeves. And made it better for them to stay here in El Paso. So we did go out, and Blue Cross Blue Shield came in with the most aggressive plans, and it was a combination plan between a PPO and an HMO. Now, right off the bat, most people have a negative jerk reaction to HMOs, but we have roughly 1,600 fire and EMS departments in Texas, and I would say roughly 80% have HMOs in there, and roughly about 50% of the employees in there are on an HMO. And that's driven because there's a different dynamic within the fire EMS departments when you're talking to younger people. They are starting their families. They're less likely to have providers that they are attached to. They are more agreeable to looking to a smaller network that gives them greater access at a lower cost. So that's where the HMO comes in. And then you've got those who want to go to a PPO. So when we went to Blue, they came back at us and they said, okay, well, right now you're on a PPO one plan, okay, with the employees. And this is where we would also change it to offer two plans, at least, from Blue Cross Blue Shield here. And these are the two that we're looking at. But right now you're at a $700 PPO rate. It's going to go to $834. Blue Cross came in and said, okay, we'll give you an HMO at a $550 rate. We're going to drop that family rate from $2,716 to $1,651. Now, if you want a PPO, we're going to drop it. It'll go from 700 to 719, and we'll drop the family from 2716 to 2159. And when you compare it to up here to the cost at the renewal with Cigna, the renewal with Cigna is simply not even, it's not sustainable. It's not something that we can continue for any much longer. The family rate, the employee rate was going to be 834. The family rate would be 32.33 here. We were looking at if the department came back and said, you know, you could come in at a contribution of just 10% more. And I think Chief has some other ideas there as well on contributions. But if you came in at $770 per member per month as your cost, which would be a 10% above what you paid last year, the employees' cost then to add their dependents on the HMO, it would only cost them $330 per month to add their spouse or their kids, compared to right now, it would be $902 or $1,113. Now, if we renew with Cigna, it'll be $1,074 and $1,325 to do that. When we get to the family costs, is where you really start to see the big change there. To add a family on the HMO would cost $881 a month. It would be, right now, it costs $2,015 a month, and it would be $2,399. Now, for those individuals who say, I really want to stay on a PPO, and you always have those individuals, that's the reason we suggest a dual choice here. That is, let's say we go with a $770 contribution per member per month. That means that an employee only for the PPO would be $0. For them to add their spouse or their kids, right now it costs them $902, $1,113. It's going to go to $1,074 at $1,325. It would drop almost by half on the Blue Cross PPO. The family rate would drop from 2015 and the renewal at $2,399 dropped to $1,389. So that you're seeing $1,000 a month difference, $12,000 less per year, and you're not giving up benefits to do that. Okay, so we're suggesting and recommending that you guys move to dual choice with Blue Cross Blue Shield. Blue Cross Blue Shield is also the plan that out there is accepted pretty much by everybody. And it accepts the hospitals. It provides for access to all of that. So that we are recommending that you guys go with the new Blue Cross Blue Shield combo, you know, or dual choice plan here. And when the dual choice, what I've shown you here is if you go with the lowest cost, okay, so assume that every single employee out there is just going to enroll themselves by themselves, and they're all going to go at the employee only HMO. Your lowest cost right now, you're $19,617. It would drop to $15,412. That's not realistic. Probably it's not going to happen. But if we go over here and we look at the most expensive option for the department based on a contribution of $770. So in this scenario, this assumes that every one of your 28 employees that are enrolled decide to enroll a dependent. Okay, that means that you're contributing a fixed dollar amount of $770 per month per member, and your cost would be $21,560. Right now, you're at $19,617, and it would go to $21,560. If you renew with Cigna, employees are not going to be able to afford the dependent costs, and your cost as a department is still going to go up. This way, by going in here and putting it at this cost at $770 or as a minimum contribution, right now, for Reeves County ESD to be on the PPO, employees have to pay roughly, it's about $348 per month, or per pay period. Sorry about that, per pay period, to have their dependents on there. So you're right in striking range of it. Okay, now, of course, we are looking, or I think we discussed some higher contributions. If you guys wanted to get a benefit or medical plan that was even richer than what Reeves said that there wouldn't be, you could actually increase this to where you were actually covering more than Reeves. And we went through some of those numbers. But if you went with the minimum contribution level that we're recommending right now, which is at $770, which is still less than the employee only rate if you renew with Cigna. Does that all make sense?
Yes, sir.
Okay. We're also recommending for you guys to be competitive with Reeves. Right now, you don't currently have a basic life and AD&D policy. Okay, that's a life insurance that the department pays for. It would be through the VFIS pool, which is insured by Standard. We provided, and I'll go through that here in a little bit here. We put it at $25,000 per member per month. Okay, to provide this, it would cost the department $210.25 per month for the entire for all 29 members. So it's really inexpensive. Now, the nice thing about it is in that life insurance, if it's a line of duty death, it quadruples at 25 to 100,000. Okay. Also, there's issues down there at El Paso with accessing in-network ambulance service, whether it be air or land, and that's because none of them are at anybody's network. So we reached out to a partner firm of ours called Massa, which basically what it does is it covers whatever the employee's out-of-pocket is for land or air ambulance. It'll cover 100% of that. Okay, the cost to cover all 28 members, and the different reason there's a different number here between these two is we have one person who is waiving on medical. So if they're on the medical plan and you provide this Massa coverage, which is ambulance, it would be $532 a month to do that. And then we were also suggesting looking at adding an employee assistance program to cover up to 50 members. And we put it at 50 because as you guys grow, it's not a per member per month. It's just an annual cost of $2,500. So even with adding all of this up, it's still going to end up costing you less per month than renewing with Cigna. So you're able to provide more benefits, lower the employee's contribution for dependents, add basic life insurance. You're able to add the Massa ambulance coverage and the EAP, and all at a cost that's less than just renewing for employee only with Cigna. Okay. And what we've done here is we did put a comparison together so you can see your current plans and the renewals. And they came in with an option. So we went back to Cigna and said, okay, what if we went to a higher deductible? Okay, let's look at a 3,000 deductible on there. Their premium dropped to $770. Okay, well, $770 is still more than when we come over here and we look at the Blue Cross Blue Shield PPO at $1,500 at $719. So Blue Cross's $1,500 deductible, which is half of the $3,000, is less than Cigna's $3,000 deductible. So Blue Cross Blue Shield came in very aggressive for you guys. And this was put together with the objective of creating a sustainable plan. So not something that every year you were worried, okay, is it going to be even something that we can afford? But something that we can sustainably put in force and project out. This year with United and Blue, which are BFIS's two biggest carriers, with TML being the third largest out there that we have, with Blue Cross and United, we're averaging 3 to 5% renewals in our pool. Okay, so at 20%, we haven't had any of those on our Blue Cross and United. Okay, the other nice thing too is with Cigna right now, your plan is based on your plan's claims count against you. By putting you into this Blue Cross pool at your size, and right now you would be considered small group. At that point, your claims do not count against you. So the fact that you guys have had high loss ratios, that won't count against you with the Blue Cross in the future. You'll just be getting trends. Okay, any questions on that?
Yes, sir.
Yep.
When we discussed this, didn't we decide that we were going to do a employee plus spouse or?
Yeah, and that was something that's the reason I mentioned that Chief was going to bring up a different contribution schedule.
And if the employee wished, they could add, if it's to make it family.
Yeah,
right?
So in other words, and I think Tommy's going to has some contribution examples too, if we increase it to, or maybe we talked about going up to 1,100 or even covering 100%. If you covered 100% of the employee spouse and employee children at 1,100 here,
Yeah.
you would actually have a richer plan than Reeves.
Right.
So we had discussed kind of like an allowance of, I think it was 1,100 with
Yeah.
88 cents.
Yep.
And leaving the employee to choose whether they wanted to go with the HMO or the PPO. If they went with the higher PPO, then they would have to pay the balance due if they chose whether to add their family, children, or spouse.
That's exactly.
It wasn't. I
that's
guess we can
exactly.
call it. The allowance is 1,100 with 88 cents that the district would be responsible for, but that the employee would have to choose
For the upgrade.
And we
for
chose-
the PPO,
Yep.
and they would have to choose.
we chose the HMO, the 1,100 because that's what it would cost for the HMO.
Right.
for employee plus spouse or employee plus child. And, yeah.
And that
So
would put
that's-
you way
That's what we got to
ahead.
1,100
How-
per employee.
Okay,
That would put you way
so
ahead
before
of
we move
Reeves.
forward, how are we looking as far as money?
So I
Yep,
added
yep.
a scenario in your Dropbox. This would only increase the budget by $150,828 with 48 cents. And what I did is I increased the, give me a second, I have my notes right here. I did a review this morning of, let's see. So yeah, it was give option for employees to choose between PPO or HMO, which is P4 or P2. This will be an increase of 150,868 with 8 cents to the budget. Attached in the Dropbox is the scenario for what we're speaking about right now. Let me see, but overall increase because we had a surplus in the budget is only 100,559 with 80.
But
I did-
Mariana, isn't that also assuming that 100%?
Yeah, I did.
Yeah, that assumes that every employee puts all of their dependents on there, which that never happens.
Right.
Yeah, and I actually accounted for 33 employees,
Okay,
not the 28 that are currently enrolled.
Should be less.
Okay. This is, where was I? I think, yeah. So I added the updated budget into the Dropbox, which only, like I said, it exceeded the additional cost of 100,559 with 80.
After we add that, Mariana, how much do we have left over off of what was left over on the
Nothing.
budget?
No more. What I did is I increased the code enforcement revenue as I reviewed it this morning. As of right now, that code enforcement is at 261,000. Last year was at 412, and the previous year was at 226. So I had actually under budgeted that amount to 150. What I did is I increased it to what we have been collecting.
Yes, sir.
So, so like Tom did,
There's
Okay,
also one on the backside.
oh,
do you want me to go on to the dental and the vision? I'm sorry.
I actually included that as well in the
Okay.
update. Yeah,
Which plan?
but you
okay,
can
which-
go over it as well if you
Okay.
want.
Which one of the plans did you include in the dental? So I can go over that. The 22 or $27?
I think it was a $27, the highest.
Okay, all right.
Yeah.
So what I did here was can you guys still see my screen?
Yes, sir.
Yes.
Okay, perfect. So right now you guys have United Concordia. We would recommend to bring your dental plan more in line with what other ESDs are doing. It also helps, it increases benefits and lowers your premium by restructuring how benefits are paid. So with United Concordia right now, you have 100% preventative, 100% basic, 60 on major, with an annual max of 2,000 per person. There is no orthodontia on there. And you have a MAC plan. A MAC plan is what's called a maximum allowable charge. It basically means that you have a network of dentists. If you choose a dentist who's not in the network, the carrier is going to pay that out-of-network dentist exactly the same amount that they would pay an in-network dentist. And that works very well in metropolitan areas like Houston, Dallas, San Antonio. Where it doesn't always work well is where you have members coming in from more rural areas, which you guys do, that have fewer dentists out there. And that means dentists don't have to participate in networks, which ends up meaning employees have to they get balance billed, or they have costs that they weren't going to be expecting. So in looking at it, your rates are, right now we're projecting a 0%, 33.53, which is the employee, and 108 for family, which puts it out there for members to pay. Now we looked at the plan that would be most advantageous to go to for your members is still less. Okay, so we recommended instead of 160 going to 180/50 with the 2,000, but adding orthodontia for both adults and children. And we put in here 50% of the or coverage up to 1,500 per adult and per child on the plan. And we recommended going away from a MAC plan and going to a 90th UCR. What that means is you don't have to use a network. Every dentist is going to be paid 90% of the usual and customary rates, which means that you end up not having balance billing occurring. And Beam, even though you may not be familiar with it, Beam is our administrator. It's United Healthcare's network, and Nationwide is the carrier behind it. It's who we have a pool built with for the ESDs. And they agreed to cover the plan with no rate increase for 2 years. The employee rate would drop from 33.53 to 27.45. Family would drop from 108.66 to 88.96. So you would see that significant savings there. Now we partnered that with Vision. Right now, you guys have we thought it was VSP, or rather your prior agent thought it was VSP that was connected to United Concordia, and it created some confusion. But Chief and Mariana and Shirley and I dug into it, and we figured out it's actually UC Vision, which is a whole different animal. It was, I'm only laughing because it took a few days for us all to figure out that they had put you on the wrong plan. But we would recommend moving it to Beam and leaving it with VSP, Vision Service Plan. That's the only carrier that we use for Vision because VSP is taken everywhere. We would recommend some changes on here. The difference here is that you'll see is the United Concordia is built into this rate, this 33. So you would actually have 27 plus the 810. So the total cost would be slightly more by $2 than your current one would be, but you would have access to a lot more in benefit. Employees would be able to have dental care wherever they're at. They would also have orthodontia built into it. And rather than being United Concordia's network, it would actually be the Beam or the Davis, I guess it's Davis Vision that they're using. It would actually be VSP Vision Service Plan, which is going to allow them access to a lot more. Now, it does have a $10 copay, but that was fairly nominal to get them into a VSP provider. So we go through, this would be the life insurance that we are recommending. It's 25,000 basic life, 25,000 AD&D or accidental death and dismemberment. It quadruples up to 4 times if it's a line of duty. Because it is through VFIS and because all that we do is fire EMS, January 1st, we removed the suicide clause from our basic life insurance. Now, we didn't remove it from the voluntary life, but we did remove it from the life insurance that a department pays for. And what that means is in the event that a first responder does commit suicide, that is not going to be excluded. Our belief is that when an individual, a first responder, has taken their life, our responsibility shifts from that individual to the first responder's family. And the last thing that we ever want them to feel is that all of a sudden there's nobody there to back them up, nobody there to support them at the biggest time that they need it. And so they would still be paid. And we made that change January 1st. And I've had 3 claims paid out so far this year. And it hasn't been easy, but it has been very beneficial to those families. But this is the life insurance that I was saying would cost $210 per month. And that covers all 29 of your members currently on there. It includes several other pieces. We also would include additional life for the employees should they want to purchase that on their own. Guaranteed issue, that way no health questions asked. And this is information that I put together for you on the ambulance service. Okay, the one that we're recommending is the Emergent Premier. Okay, this $19, which we showed you a total cost for the department of $532. It's $19 per employee or per member per month. That includes the member and all of their dependents. So whether they have 2 dependents or whether they have 10 kids, it's $19 per month. And that was in that cost at the very beginning, that was $532. And as we go further on would be the Employee Assistance Program. And this is specific to fire, EMS, and police, which are the public safety market that we work with. It's the public safety pool that we have built with ESI. I can go through a lot of information on this. It is not your traditional EAP. It covers everybody in the family as well as dependent children living away. But it deals with specific situations that fire, EMS, and police are going to deal with. PTSD issues that they will see, PTSD issues that their dependents are going to see. When you have members who are trying to get promoted within the department, they can do their courses through here free of charge. It will help you guys or the department when you have issues such as substance abuse or anger issues, that you can reach out then to the EAP. They will actually make sure that you guys stay compliant. Okay, so that you're not sued by the Department of Labor when somebody is having a substance abuse problem and you don't want to get rid of them, but you're trying to find a way legally to advise them, to help them get help. This is where the EAP will get involved and do that for you. Okay. And this is all in that package. There's a lot of information in here, but it is specific and only available to first responders. The cost on this EAP is $2,500 for the whole year. When Mariana, was that included in your costs?
No, it actually was not.
Okay, all right. So any questions on these?
No, sir.
I went really
Mariana,
fast
so
through that.
what was included in the package? It was a 1,100 allowance
Yes,
per
the
employee?
1,100 with 88 cents, what was, and the dental and vision.
The dental.
Yes.
Okay.
Okay, so the basic life and the MASA EAP would be additional.
What was that again, Tom?
I'm saying, so the employer paid life and the MASA ambulance service and EAP would be additional expenses.
Yes.
Let's see if we're looking at, I'll do a real quick calculation for you.
I think I'm looking at 11,407,
Okay, you
but
might
with
be,
the numbers that we have right now.
yeah, and that's at 29 members.
Yeah, if it were the 33, what does that increase?
The EAP doesn't, but the other two do slightly. Yeah, so 11,407 would be the annual cost for the 29 members.
What would it be for the 33?
Okay.
If,
Let me do that real quick here.
please.
Yep.
Mariana, how much was the dental and vision extra?
The vision, the dental was 27.
Mhm.
Give me a second, let me have it.
And that's an existing expense currently.
Yeah, we
Okay.
currently cover for them.
Okay.
So your cost annually at 33 members to add the employer life, the ambulance and the EAP at 33 members would be 12,895.
I'm sorry, Tom, can you repeat that again?
To add 33 members to the basic life, the
Okay.
ambulance and the EAP, the total expenditure for the year would be 12,895.
Okay, thank you. So I added for the dental commissioner, Santana, 2745, which is what we do cover for the employee,
Okay.
and the 810 for the vision.
Yeah, that's currently in the expenditures.
Yeah, that was already added.
Okay. Commissioners, if I may, I think if you're considering giving it all the employees the 1,188, I think we should leave the ambulance out and the EAP until we get the EAP for all our volunteers as well. I think that's very important for all of them as well.
Yeah.
I think it's something that we should right now not consider, and if you're going to consider the other, just the benefits like we've had, and then look at it next year and go from there, or we can revisit this during the year if we can go, because at a cost of $2,500 per department, it's not bad, and we can probably take it from one of the line items that we have there, because it's a
Okay.
good benefit for all of them,
For every department.
for every department.
I agree.
And I can tell you, if you add your volunteers, the cost per year up to 130 members, including volunteers, would be 3,500.
Oh, that's not bad.
Yeah, so it's 3,500 to cover up to 130 members. Sorry, my throat.
If you get us the price to cover 150,
I can. Yep.
So again, as we spoke on that Friday, was the employee would have the option to choose whether they want to add their spouse or their children on the HMO. And we would obviously cover the whole cost,
Mhm.
but they have to choose one or the other. Now, if they choose family, then they need to pay the balance. The same thing with the PPO, they would have to pay whatever the balance would be. So basically, the allowance would be 1,100 with 88 cents that the district would cover.
And I can
depending
tell
on,
you,
go ahead.
Reeves County does not pay 100% of employee, spouse, or employee child, so that will put you ahead of them.
So our biggest concern was retention for employees, and of course, covering them.
Right.
And that's why we've been doing this. You guys have any questions?
I don't, it's clear, and I think I think it'd be a good deal for our employees. It'd be the right thing for us to do. Tommy, can I get your input, please? Like your input on this before we make a decision. I mean, I value your.
I was here for that meeting, and we went through that, exact same scenario. And, the fact that you have, again, the Blue Cross Blue Shield, a much better plan, one. And two, the fact that they're gonna be able to go almost anywhere and not be denied any coverage or have to pay more out of pocket, et cetera. I think that 1,100 was more sustainable, based on the numbers and, which is something that if you keep that, of course, anybody here, any of your staff can, use that $1,100 credit, so to speak. And if they decide to go with a PPO plan, or if they decide to add their family members, that's the whole family, spouse and family, be another $500 out of their pocket. And any of us here would salivate to be able to do that now for our own selves. So, it's competitive. Tom, my tocayo just said, it'll be richer than Reeves County. And, it seems to be one of the, employers or entities that's kind of competing with.
Selling
Yeah.
It'd be a selling.
Absolutely. And again, more importantly, Counselor, the issue here, the word that we keep using is sustainability. And, the fact that you're taking a leap with, doing all the volunteer stipend program plus, Commissioner Avalos bringing that up, saying, I want to do more as far as coverages. Well, here it is. I mean, here's that open door, and I think it's a great plan.
And I think it's great because there's some of the paid staff that have families, that have kids.
Absolutely.
And, of course, I mean, Mariana would benefit from this with Faith, and I think it'd be great. I'm for it. I'm for it, gentlemen. I don't know how you guys feel about it, but I'm for it.
Yes, sir. I'd like to make a motion and
I'd second it.
to go with a 1,188 cents allowance. They can choose between the HMO and the PPO and the Blue Cross Blue Shield, and continue with their dental and vision. We also, as far as the EAP, we have to look into it for all the departments and including our employees. So that one we'll look into it.
and the reason I say let's postpone this, because Tom said, correct me if I'm wrong, Tom, the next ESD up the street is doing it. If we merge together to do the EAP, it'll be half and half.
Yeah, it drops the more people that you come on. So yeah, we can merge as many of you as you want down there, and that way you get the lower cost per member per month.
It'd be with ESD one or, okay.
I mean, that's if something that the board wants to do and
Yeah.
try to get a lower price if we merge. I gotta talk to the
Yeah.
chief over there first, see if he's willing to consider that.
If he's willing to consider it, you know.
And instead of him paying the full pot for his guys, he would pay half.
Mhm.
Sure.
All right. So motion was made.
Second,
Did you guys want to add the life insurance in there?
No, sir.
That was the $210.
No, sir.
Not at this time.
Not at this time.
Okay.
Tom, is that something the employee could get if he chose to?
We would have to quote it a different way, but yes, we can put it that way. Yeah.
I think we can give the employee the option if they want to sign up for it. I think that'd be a
Can you have-
decision. Yeah.
Can you have that ready for the employees when they do the
Oh, yeah.
sign?
Oh, yeah. No worries.
Thank you, Tom.
You're
I have
welcome.
item number 13, discuss and take action on healthcare benefits for all district employees at to be covered at 1,188 cents plus dental and vision. And the employee will cover the rest of whatever they want to cover. A motion by Commissioner Santana, second by Commissioner Diaz. Commissioner Diaz,
I,
Commissioner Santana,
Aye.
Commissioner Glidden.
Aye.
Motion carries.
thank you, Mr. Newbie.
All right. Thank you,
Thank you, Tom.
guys. Thanks so
Tom.
much. I'm going to head out and head back to the bed.
Thank you, Tom.
All
Hope you
right.
feel better.
Thanks. Bye-bye.
Very well put together by the team that worked on it. Thank you, guys.
Yes.
That was awesome.
Thank you.
Item number 6, discuss personnel matters report by Cano HR Group.
Good evening, Board. A few things, the scheduled training, we have, 2 stations that we have confirmed scheduled for training. It's gonna be on 9-2 for Montana Vista, and on West Valley, it's gonna be on 9-7. We also have interviews tomorrow at 9 AM, with chiefs, for the maintenance supervisor. We have 3 people that are coming. Yes, sir.
Montana Vista is 9-2, and then
West Valley is
West
on
Valley.
9-7.
West Valley, what day again?
9-7.
9-7.
Those are the 2 we have confirmed so far.
Can you all send me the times, please?
Sure. Yeah,
If I can
okay.
make it up there, I'd like to try and see if I can.
For both or?
Yeah,
one of them?
I'll try and make as many as I can.
Okay.
I'm all over the city of El Paso, so if I can,
Us too.
yeah, if I
Okay,
can make it in,
Okay.
it's just,
I'll update you on those times.
okay. Thank you.
And then, as I was saying, we have interviews tomorrow at 9 AM. We have 3 people who have confirmed coming tomorrow. Hopefully, we get to interview 3 people tomorrow
This is for what position?
for maintenance supervisor.
Maintenance supervisor.
That's been a hard one to fill. But we have them tomorrow at 9, so hopefully we get people to show up. Any questions?
Man, thank you.
Hopefully I'll have an update that we hired somebody.
Yeah,
You,
somebody awesome.
Item number 6, informational purposes only. Item number 7, discussion of monthly reports by Chief of Personnel Department heads. Go ahead, Marina.
Good evening, Commissioners. In the month of July, we paid 557,000 in accounts payables. We had our presentation yesterday with the county court commissioners. They did notify us that they will be voting after you all vote for your budget and the tax rate. And that meeting will be on Monday coming up. That's pretty much I have the other items coming up for budget and the adoption of the tax rate. Thank you.
Go ahead, Mr. Olmsted.
Commissioner Jimmy Olmsted, Logistics Compliance. We're doing pretty good, closing out the fiscal year. Some last minute order stuff we're putting in for. I pretty much got that next gear order ready, just waiting for the new budget when it kicks in. And get some new gear ordered to replace stuff that'll be expiring next year in 24.
perfect.
And that's about it.
Sir, how's it going with the chiefs from the volunteer side? How are they working better with you now?
Yes. Much better,
Good.
much better.
Lines of
Much better
communication are
cooperation.
open.
Much better because they realize that it benefits them if they work with me instead of against me.
Good.
Yeah, we're working pretty good together, all of us. We're doing good.
And they're turning in things on time and
When I ask, they will. A couple of times I have to remind them, but they get it to me.
for the most part.
Yes, sir.
Okay,
Yes, sir.
perfect.
Thank you.
Thank you, sir.
Chief Salcedo.
Good afternoon, Commissioners. Joe Salcedo with ESD2. I've got nothing new to report.
Thank you, sir.
Thank you, sir.
And Chief Esparza, ESD2, nothing to report, Commissioners.
Thank you, sir.
Item number 7, information only. Item number 8, discussion and take action on adopting the district's 2023-2024 budget submitted by Chief Esparza. Go ahead, Mariana.
Commissioners, you would just need to approve the adoption of the budget with the scenario of the added insurance, which is on the Dropbox.
Okay.
You have any questions?
No, ma'am.
Do I have a motion?
I'll make a motion to adopt the budget 23-24.
A motion by Commissioner Glenn. Do I have a second?
Second.
Second by Commissioner Santana. Commissioner Diaz,
Aye.
Commissioner Santana,
Aye.
and Commissioner Glidden.
Aye.
Motion carries. Item number 9, discuss and take action on the adoption of the 2023 ad valorem tax rate of El Paso County Emergency Services District Number 2 of 0.086457 per 100 valuation, consisting of a separately approved debt rate of 0.033414 and separately approved a maintenance and operating rate of 0.053043 per 100 valuation, and authorize the appropriate district officials to implement same and execute necessary orders for same. Submitted by Chief Esparza. I have a motion, Commissioner.
Motion to approve.
Second.
A motion by Commissioner Santana, second by Commissioner Diaz. Commissioner Diaz,
Aye.
Commissioner Santana,
Aye.
Commissioner Glidden.
Aye.
Motion carries. Item number 10, discussion on costs regarding EP 911 center to provide dispatch services. Commissioner, can we move this to executive session?
Yes, I'd like to make a motion to move it to executive session.
Second.
I have a motion by Commissioner Santana, second by Commissioner Diaz. Can we go over the continued items until we get to that point?
Yes.
Item number 11, discuss and take action on approving an inspection of non-gas fired 5-year tower for the following locations: 510 East Vinton, 13978 Montana, 11440 North Loop, and 14885 Las Colonias Road for fire facilities, steel fire training towers, and the amount of 42,000. Commissioners have looked over the years to see who could do these inspections. Finally, fire facilities, I guess they saw the need, and now they have engineers that they can contract to do the inspections here. And our buildings are in need of the annual inspections.
Motion to approve.
This does not cover any repairs.
This does
just
not
for
cover
inspection.
repairs. This is the annual inspection where they're gonna say what's wrong with them.
Okay.
But they need to get inspected.
yeah.
So we can find
Second.
exactly what needs to get done.
We have a motion by Commissioner Diaz, second by Commissioner Santana. Commissioner Diaz,
Aye.
Commissioner Santana,
Aye.
Commissioner Glidden.
Aye.
Motion carries. Item number 12, discuss and approve the purchase of a thermal imager for pumper 601 through Casco Industries, Inc. in the amount of $9,770. Submitted by Chief Esparza. Commissioners, as you know, we purchased a new pumper. It is in need of a thermal imager, as the other pumper they had left with the thermal imager. This is to replace a new one for that truck. And we are finding a hard time to getting a thermal imager because Scott Air is no longer gonna be selling thermal imagers. All they have is a little baby one, so it's gonna be tough getting a thermal imager. Unless we go with a FLIR or this one that we're gonna go through Casco.
Motion to approve on this.
I'll second.
We have a motion by Commissioner Diaz, second by Commissioner Glidden. Commissioner Diaz,
Aye.
Commissioner Santana,
Aye.
Commissioner Glidden.
Aye.
Motion carries. Item number 14, Discussion, take action on approving the repair of two private hydrants at the West Valley Fire Department located 510 East Vin through 5-star automatic fire protection in the amount of $5,775. Commissioners, this was submitted by Mr. Olmsted. They did the inspection. Two of them lost the rod that goes to the bottom. So they'll have to replace the whole thing. Something that needs to be done.
Motion to approve.
Second.
A motion by Commissioner Glenn, second by Commissioner Diaz. Commissioner Diaz,
Aye.
Commissioner Santana,
Aye.
Commissioner Glenn.
Aye.
Motion carries. Item number 15, discuss and take action on the contract with Horizon Police Department. Commissioners, can we take this into executive as well?
Motion to take this into executive.
Do I have a second?
Second.
Motion. The motion was made by Commissioner Diaz, second by Commissioner Santana. Commissioner Diaz,
Aye.
Commissioner Santana,
Aye.
and Commissioner Glenn.
Aye.
Motion carries. Item number 16, discuss and take action on terminating the agreement with the city of El Paso for the P25. Also, Commissioners, can we take this into executive session?
Motion to take this into executive session.
Do I have a second?
Second.
Chief, this is for the tower up at the landfill, correct?
No, no, sir.
This is another one?
Executive session, El Paso County ESD number 2 is now entering into closed meeting pursuant to Texas Government Code Section 551-071 to consult with district attorney concerning all matters identified on the agenda where the board members seek advice of their attorney in privileged communication. The date is Tuesday, August 15, 2023, and time is 6:49 p.m.
El Paso County ESD number 2 has completed its closed meeting. The date is Tuesday, August 15. Time is 7:28. Item number 10, discuss the cost regarding 911 center to provide dispatch services to the ESD submitted by Commissioner Barnes.
Motion.
Do I have a motion?
Motion.
Second.
We have a motion by Commissioner Diaz, second by Commissioner Santana. Commissioner Diaz,
Aye.
Commissioner Santana,
Aye.
and Commissioner Glidden.
Aye.
Motion carries. Item number 15, discuss and take action on the contract of the Horizon Police Department.
Make a motion to proceed as deliberated.
Second.
A motion by Commissioner Santana, second by Commissioner Diaz. Commissioner Diaz,
Aye.
Commissioner Santana.
Aye.
And Commissioner Glidden.
Aye.
Motion carries. Item number 16, discuss and take action on the termination of the agreement with the city of El Paso for P25 radio system.
Make a motion to authorize Chief Esparza to proceed as necessary.
Second.
I have a motion by Commissioner Santana, second by Commissioner Diaz. Commissioner Diaz,
Aye.
Commissioner Santana,
Aye.
Commissioner Glidden.
Aye.
Motion carries. Commissioners, can I have a motion to delete item number 19, 17, 18, 19, and 20?
Motion to delete.
Second.
I have a motion by Commissioner Santana, second by Commissioner Diaz. Commissioner Diaz,
Aye.
Commissioner Santana,
Aye.
and Commissioner Glidden.
Aye.
Motion carries. Item number 21, discuss to approve the next meeting to take place on
Be the 19th, I believe. Yes.
September 19th
Yes, sir.
at 6 PM. Do I have a motion?
Motion.
Do I have a second?
Second.
I have a motion by Commissioner Glenn, second by Commissioner Santana. Commissioner Diaz,
Aye.
Commissioner Santana,
Aye.
and Commissioner Glidden.
Aye.
Adjournment at 7:31 PM.